Hello everybody and welcome to the Tuesday edition of Video Clips. As usual, a couple of announcements. I am so excited about the course that I just started yesterday on cognitive disorders and Alzheimer's disease. And so you're thinking, if it started yesterday, why are you telling us now? Because we tape all of these things. You'll be able to watch this on the video platform or listen to the recording. It's a 4-part series, and I found so many interesting things to talk about because there's so much more to this than just Alzheimer's disease, and there's more to it than just old age. And I had trouble trimming it down to 4 classes because I could have made it 8 classes and not run out of things to say. So if that's a topic that interests you and it affects almost every family these days, you might want to look into taking the course, and you can join us live for the next 3. And then upcoming microbiome, cannabis, and irritable bowel. Fall semester is ready to go, and it is posted online for the Institute, the Diet Lifestyle Intervention course with packages of certification courses. And then if you don't want to take the Diet Lifestyle course, the Nutrition Educator program, which is the alternative to dietetics, if dietetic philosophy is not necessarily what you are interested in, check out our educational offerings. A lot of people would like to have a concentrated course in nutrition, but they don't want to go back to traditional 4-year college and get a dietetics degree. Got all kind of stuff going on here, so check it out. We hit over 30,000 subscribers as of last week, so we're going to do a drawing, and I will announce next week the name of the person who wins a free course from us. Some of you asked about my exercise program because I've been putting, and I have another exercise piece that we're going to talk about today as well. So I'll tell you what I do for exercise, and I'm going to give you a caveat first, which is that I have a lot of control over my time. Right across the hallway from this office is a hot yoga studio, and about 50 steps away is a gym in the back of our building. So it's kind of convenient for me, and keep that in mind. But the first thing is I do 2 really good strength training exercises a week, and some of you commented on my arms being kind of well formed. That's why I lift weights. I also do 2 or 3 yoga classes a week, and I run a couple, 3 times a week. And yes, that's more than 1 thing a day some days, but again, I have control of my time. I'm in this business. What you do have to do is not necessarily what I'm doing, but you need to do 5 or 6 days a week for 45 to 60 minutes in your target heart zone with at least a couple of strength training sessions. If you want to be lean and mean and live to be 100 and be in your own house and all that sort of thing, which is my goal, or 120. I'm starting to think a little bigger than just 100. So that's my exercise program. And then many of you who send videos and articles with your comments, I don't post the comment unless I have time to check out what you send me, but I do keep a list of things to check out. So keep watching these video clips, and I promise there will be more commentary on some of the things that you send to me for comment. Okay, so I'm not forgetting you, but it takes time to do a thoughtful comment where I actually do some research to get back to you with thoughtful information, right? Instead of just off the top of my head. And you're really not interested in my opinion as much as what the research shows about the various things that you're sending to me. And I want to respond with the right type of reference material. One other thing I'm going to add, well, actually a couple of other things. We just added for our conference, November 8th through 10th, we are going to have a panel discussion back here at our office following the close of the formal conference on vaccine mandates, with some parents and doctors and health professionals and advocates, and we'll present a good, fair, and balanced view of the issue. But we've added that, and we think that's interesting to a lot of people. With the issue of censorship, I wanted to mention something that I found out last week that's very disturbing, and that is that the censorship issue, which I've talked about on this channel, is not just being exercised as it pertains to vaccines. My good friend Dr. Ralph Moss, who's been issuing reports on alternative cancer treatment for the last, I think, 30 years or so. I've been doing business with him for 20-some years. Anyway, a documentary was made about his unfortunate experience at Memorial Sloan Kettering in New York and the Laetrile issue, and I'm not going to spend a lot of time going into it here. It'd be interesting to cover in a different video clip. But what I will tell you is that that film was posted on Amazon Prime and was taken down because it was considered too controversial. It's a factual documentary. There's nothing in there that isn't factually true. In fact, people from Memorial were interviewed for the film. But it's been taken down because it's controversial, and this should frighten the heck out of all of us, because when we can no longer enjoy free speech in our country, we are really headed down a very bad path. So I'm pointing this out to you because I'm concerned about it, and I think you should probably be concerned about it too. All right, so exercise decreases hot flashes. Everybody would like to have a different solution to the hot flash situation other than, oh, here we go again, exercise, because Pam's always promoting it. All right, so why do women take hormone replacement therapy? Because they have menopause symptoms that are miserable, and they don't like being miserable. And these symptoms include hot flushes and night sweats. And so the problem with HRT, and I think most people have some awareness of this right now, is that there are serious side effects of pharmaceutical hormone replacement therapy, including an increased risk of cancer. In fact, a relatively new member of Wellness Forum was diagnosed with breast cancer, and the first thing her physician said when she was diagnosed is, well, we better get you off those hormones. And her comment was, why didn't somebody talk to me about not taking those hormones if this was such a risk factor for the cancer I now have? So women then turn to bioidentical hormones, and the answer to the question about that is we just don't know. We don't know if they're safe. We know that they can be effective because women claim that they're getting relief, but we don't really have any safety data. So women are looking for better alternatives than any type of hormone replacement therapy, pharmaceutical or bioidentical. Exercise is a good option. It's been proven to be effective, particularly for relieving hot flushes, which is one of the most irritating symptoms that women experience associated with menopause. In a recent study, postmenopausal women with an average of 7-point hot flashes that were moderate to severe per day were randomized to a 15-week resistance training program or no change at all in their physical activity. And at the end of the study, the incidence of hot flushes was reduced by 43.6% in the exercise group and 2% in the control. Now, this is just in 15 weeks. We're talking about less than 4 months. So if you keep at it, keep exercising, change your diet in some productive ways, these are symptoms that can be made to be gone. This isn't the only study that has shown such a positive effect. 21 postmenopausal women who were having regular hot flashes were randomized to 16 weeks of supervised exercise training or control group. Women who exercised had fewer hot flashes per week and also showed improved cardiorespiratory fitness. Well, of course you're going to have improved fitness. There's all kinds of other side effects aside from making the hot flashes go away. The authors of the study were able to identify the mechanisms of action that cause reductions in hot flashes. Exercise reduces basal core temperature, it improves blood flow, and it improves sweating capacity. And that's the reason why women feel better. Another mechanism of action is weight loss, which can result from exercise, obviously. Being overweight or obese has been shown to increase many menopausal symptoms, such as hot flashes, urinary urgency, vaginal dryness, and joint pain. And one of the reasons is that a lot of people think that menopause is an estrogen deficiency disease, and it's really not. It can be an estrogen excess disease because if you're overweight, your ovaries may not be pumping out estrogen, but your fat cells produce hormones that are converted to estrogen in the bloodstream by an enzyme called aromatase. And so it's quite possible to be postmenopausal and have higher estrogen levels than you did when you were of reproductive age. Many types of exercise are effective for reducing hot flashes. Yoga has been shown to have a positive effect. So I don't think it's the point that you have to lift weights or do yoga or do anything in particular, as much as it is that if you make exercise a regular part of your life and it's aggressive enough that you end up becoming more fit as a result, you're going to lose weight and your menopausal symptoms will be reduced and maybe even go away. And as I mentioned earlier, if you combine that with dietary changes, you can make this all happen much faster. Another thing that I'll mention is that exercise decreases the risk of developing cancer instead of increasing the risk, which is the case with hormone replacement therapy. It increases the risk of cancer. And there are other benefits: weight loss, better sleep, healthier bones, and lower blood pressure. Now, one other reason I'll add to the reasons why menopausal women should exercise, and it has to do with living your life as an independent person. The leading reason for people to end up in a nursing home is frailty. They either can't bend over and tie their shoes and walk up and down stairs and pick up something out of the trunk of the car and carry it in. Either that or they fall and they break bones. And so, and it's not because they have osteoporosis. I mean, I've seen falls where the trajectory would break the bones of a 14-year-old, not just a 65-year-old. All right, so if you want to live independently, you have to have strength, balance, and coordination, and you're only going to get that from exercise. You can't sit in the kitchen and eat protein and end up with good balance and coordination and strength. You really have to get in the gym and out there running and doing things. I mean, you can choose different types of exercise, but exercise is the pathway for doing it. And the time to exercise is now, not wait until you're frail. And just something I'll share with you personally. Some of you know I had a lot of difficulties with my mother from birth, actually. It didn't start just when she got sick, but all that aside, different story for a different day. When she was sick, it was a tremendous burden on our family, financially and taking care of her in the whole 9 yards. And I talked to her on a number of different occasions about improving her health, and she didn't listen to me, which is why she died a lot earlier than she should have. But the point that I wanted to make about this is, and I remember this very clearly, there was a point in time when my mother, I think, thought to herself, and she said as much, even if she understood or saw some merit in what I was telling her, she was so far gone that the amount of effort it would have taken to come back from where she was so horrific that she just couldn't see herself doing it. And she didn't do it. I mean, it was just the last 10 years of her life I wouldn't wish on anybody. So my point is, don't wait until you've had something cataclysmic happen with your health and you're so frail and beat up from old age, because you don't have to be, but don't wait until that point in time and then say, gosh, I remember what Pam Popper said on that video clip, I should be exercising, I think I'll do it now. Do it now and not 20 years from now. Now is always the best time to start anything, right? Okay, well, that's all for today. As usual, hit the subscribe button if you are not already a subscriber. We'll be back to you next week with the winner of the drawing. And pass this on to anybody who you think might enjoy watching it, and I'll be back to you on Thursday with more news.